All right. Hi, everyone. I hope you found your way back to this stage following that last incredible panel of our local advocates. I know some of the just words that stuck with me from that panel: cultural humility, nuance, accountability, identity, and I'm certainly left inspired and also sitting with the complexity of some of these issues. So I hope you all enjoyed hearing from those local advocates. We are now going to be turning to really hearing from our statewide partners about their experiences and their policy recommendations. And so I'm going to do a lightning round of introductions and then hand it over. So first we'll be joined by Rosa Flores. She's the Senior Programs Manager at the Latino Coalition for a Healthy California. We'll be joined by Montana Weeks, the Communications Coordinator at the California Consortium for Urban Indian Health. Belinda Van Zant Perez, the Grants Manager at the California Black Health Network. And Mandy Deek, the Director of California at the Southeast Asia Resource and Action Center. Thank you all so much for joining us, and I'm turning it over to my colleague, Carolina.
Hi, everybody. Great. So you just heard introductions from Kieran. We're going to be now hearing from the state partners who served as helping hands to the local partners you just heard from. And we're going to hear from them about which local partner they worked with, what county they worked with, and how they worked with these partners and counties. And then the second question is, they're going to share an achievement that they're proud of from this past year in working with their local partners and a goal that they're still focused on in the next year. So let's go ahead and bring on the state partners onto the screen, Vincent. Thank you. The movement is so fast. I always think there's going to be a delay, but this application moves very quickly. So that's good for us. Awesome. Well, thank you all so much for joining. Really excited to see your faces. I wasn't able to see you backstage, so it's great to see you live. Let's go ahead and dive right in. I think we will start with the California Consortium for Urban Indian Health. And Montana and Valentine, if you could share your name, your pronouns, the community that you work with, and which local partner and county did you work with this last year, and how did you work with them? And then I'll ask you to pass it on over to Rosa after you speak.
Great. Thanks so much, Carolina. Like mentioned in our introduction, my name is Montana Weeks. I am the Communications Coordinator for the California Consortium for Urban Indian Health. My pronouns are he, him, and his. And we are the statewide partner supporting Bakersfield American Indian Health Project, who you heard from in the previous session. How we worked with them was the other part of that question. So because CPEHN, our acronym, because CPEHN is a consortium, we are a member-based organization, and Bakersfield American Indian Health Project is one of our members. And so it is the nature of our organization to provide, various forms of training, technical assistance, consulting, policy regarding policy or research evaluation. So we already have a relationship with the urban Indian health programs across the state. And so doing this type of work is not natural to the structure of our organization. So working especially in terms of policy and working at the county and local level. And so working with them in this capacity was kind of just an extension of a lot of the work we already do on behalf of our member organizations, Bakersfield included. But this year, of course, in the context of this project, it was a lot of, helping with providing a framework for organizing around kind of those targeted mental health, services administration, act programs or service offerings. And arranging the event regarding where they could bring together community, the interviews and listening sessions in order to gain particular insights in that particular aspect of the community's helpful needs. And I'll pass it to my colleague Valentine.
Well, good afternoon, everyone. Montana said it all so beautifully, but I'll just introduce myself. My name is Valentine Antony. I'm Mohawk, and I am the Research and Evaluation Coordinator for the California Consortium for Urban Indian Health, CPEHN. And we were supporting Bakersfield American Indian Health Project during this cycle of the project. And I will pass it over to Rosa.
I feel so lucky to be a part of this panel. It's so exciting. My name is Rosa Flores. My pronouns are she, her, hers, and I am the Senior Programs Manager with the Latino Coalition for a Healthy California. We've been working for the last year, we've been working with Visión y Compromisos, Comité de Promotoras in Kern, so focused in Kern County. And much like our partners at CPEHN and all other statewide partners, we've been technical assistants in the project. So our job was really to get an understanding of the lay of the land and to be really transparent. We identified some tensions from the very beginning, I think. And I think that's to be expected. One of the themes that we heard in the remarks from the LLEs, right, was about accountability. And that certainly was front and center for us throughout the entirety of the project work. And so, we learned that historically the Kern BHRS interactions were a bit transactional. So, sending out a flyer, sending out, posting on social media, making an announcement through a listserv. But we also learned that there was, the infrastructure for potential engagement that was more collaborative and more hands-on. So, we did the work to understand where the tensions lay with Visión y Compromiso, with Kern BHRS, and then we rolled our sleeves up and were able to connect with folks with the help of Líderes Campesinas and Unidad Popular Benito Juárez to really center those community voices of promotores and other folks with lived experience in informing the processes of Kern BHRS. So we helped with outreach and recruitment. We developed a facilitator's guide that was bilingual. We helped with, best practices for facilitation during the listening sessions. And then we helped put together a comprehensive report that has ended up being bilingual and is a really awesome toolkit for the community. And Carolina, did you want us to answer the second part of your question about a success now or later?
Gosh, I don't know. We could do it either way.
I'll pause.
Great.
I'll pause and hand it over to the next speaker.
Awesome. Cool. Next speaker is Mandy. I'll pass it over to Mandy.
Thanks, Carolina. And hi, everyone. Great to share space with you all today. My name is Mandy Deese. I'm with the Southeast Asia Resource Action Center, also known as CRAC. And this year for this project, we worked with the Hmong Cultural Center in Butte County and with the Hmong community specifically. And with this partnership, we actually have had a longstanding partnership together for quite a few years already. But our core approach, I think, to this project was to make sure that our work and all the events that we were hosting was grounded in the Cultural Center's strong ties to the community, since they've been there for almost, I guess, over 2 decades, actually, as Sang had mentioned earlier. And we did help with a lot of the coordination and provided thought partnership in the content and execution of the various events. And we were a bit ambitious and did quite a few to try to tailor to different populations in the community, but all of that was fully guided by the Cultural Center's strong presence in the community and in the county. So, for example, in planning our listening sessions, which we had 2, we considered the intergenerational divide that is often present in mental health conversations for the community, as Sang had alluded to earlier. So we actually held separate listening sessions, one targeted just for the elderly and older adults, and we tried to tailor that by anticipating, some of the technology barriers as well as language barriers, and held those sessions in language in Hmong. And then also tried to do a separate one for youth as well, so that we were able to facilitate more meaningful discussions and better bridge the divides and have conversations about how different outreach and different community engagement strategies would be effective for youth and for older adults and elderly groups as well. And I think this was fairly successful, except for a few technology hiccups you heard about earlier that we definitely learned from. But it really helped create a safe space for community members to share their personal stories, as well as personal support needs in their efforts to learn about and to access mental health needs. And so I think we were able to really develop tailored recommendations, and folks provided great feedback for a lot of the events as well. So I think in our partnership, we really helped with the coordination, but the Multicultural Center really did the heavy lifting in bringing meaningful stakeholder engagement to these spaces and making sure the events were fruitful and successful.
I had a word pop in my head when you were speaking, Mandy, about something that several of the kind of mini briefs in the report talked about, which was the need to slow down. And something about what you said just made me think, how important it is to slow down when we're putting together engagement opportunities for partners and community members. It's just, we take it, I think policymakers take it for granted, all of the thoughtful technical assistance that you have to provide to make sure, to serve as that backup support or sounding board. That's what I should say, sounding board to local partners, because as you said, they really are the lead on these listening sessions. So I'll go ahead and pass it to Belinda to hear from you, which partner you worked with and how you worked with them.
Hi, good morning or good afternoon, everyone. My name is Belinda Van Zant Perez. My pronouns are she and her. I am from California Black Health Network, and our partner is Restorative Justice for Oakland Youth, RJoy, who you heard a presentation from earlier. So we collaborated with them to work with the Black community in Alameda County in the Bay Area. And for this partnership, we were really excited to have the opportunity to work with this great organization. This was actually our first opportunity to be able to collaborate with RJoy. And this opportunity really helped to establish a new partnership between our organizations and to be able to provide services to reach the folks in Alameda County. And so we were really excited about this collaboration to be able to serve those folks. And we were able to collaborate with them. Again, RJoy also did most of the heavy lifting with the providing the listening sessions with folks in the community as a part of their already established healing circles. And so we participated just to help with the coordination of the events, which were all held virtually. And we convened 3 listening sessions and 1 larger convening session with stakeholders, including some policy advocates in the area, and really just glean information and listen to what the community is asking for, what some of the needs are, so that way we can better collaborate and better serve individuals. As Jody was mentioning previously, folks have various different needs, and so making sure that we're able to be that listening ear to collect that, but also have a responsibility to follow up and continue the engagement with folks from the community as well. So that's one way that we really wanted to establish that partnership, was to be able to continue to work with our partners in starting in Alameda County and then hopefully moving on to broader areas in California.
Thank you so much, Belinda. And Belinda, I wanted to let you know that your audio sounds perfect. And your video is freezing on my side. So if you would like to mute your video, you're welcome to do that. But your audio is absolutely perfect. Thank you all so much for sharing about which partners you worked with and some of the initial ways that you partnered with these local organizations. I'm really excited about this next question because the work is not done and you all are going to continue to serve as state partners. And I think also you used the word technical assistance. partners to these local organizations. So I'm really curious to hear. And we'll start with Rosa on this one. So as a state partner to Visión en Compromiso, can you share one achievement that you're proud of in this past year, and one thing you're still focused on in the next year?
Yes, it's hard to pick because we've had a lot of wins, but I think the most important is that we've been able to plant a lot of seeds in a lot of different places, both within the department, so current behavioral health recovery services, and also with the promotor leaders in the region, that is conducive then to working together in a way that's transformative instead of transactional. So I said that in the last piece. And what you just mentioned earlier about slowing down, I think there's this sometimes misunderstanding around a sense of urgency in the policy advocacy space. And so sometimes there can be a perceived idea that, we just need to keep going. We don't have time to translate things into different languages or, make time accommodations, or we just need an X number of experiences to count as engagement. And so what we've done through our work is really helped folks look at the issue more holistically. I think Natalie also used that word, and be able to work better together. And then I'll add to that with a specific example. We were recently at a meeting, the Cultural Competency Resource Committee meeting, and there is a liaison there that is kind of leading the efforts of community engagement within the different BIPOC communities. And she openly stated at that meeting, which is open to CBOs and community folks, and then also a lot of the current BHRS staff, that it doesn't take a degree, it doesn't take a PhD, it doesn't take someone with a specific title to be part of these spaces. She really made it clear that lived experience is important experience, and that needs to be highlighted through all the different decision making in the department. So that in and of itself is, those are values of equity in practice, and something that we're looking forward to continuing to nurture, and so that we're able to provide more comprehensive services for the Latinx community.
Great. And maybe you folded this in, Rosa, and I just missed it. Is there a goal that you're kind of forward thinking, something you're focused on moving forward? Did you fold that into your answer and I just missed it?
Yeah, we want to get more promotores at the decision-making table. So Visión y Compromiso currently is actively engaging in a couple of upcoming events that are hosted by current BHRS, but I think our ultimate goal is to expand the number of promotores who are engaged in these spaces. So we're looking forward to working on that in the next couple of years.
Thank you. Thank you so much, Rosa. I'll pass it to Mandy to share what was an achievement you're proud of from this past year in working with Hmong Cultural Center, and what's one goal you have for the future?
Thank you. I guess to ground the question, we really had like a two-part goal in executing the project this year. And I think one was to educate stakeholders about the Hmong community specifically, and how cultural beliefs tied into what is meaningful for culturally competent mental health care. And then the second part is to uplift, of course, the resources and the funding that's available, and how community members can actually make their voices heard and be part of the local advocacy process. And I think the biggest achievement we saw, and we talked about this quite a bit in debriefing with the Hmong Cultural Center, is just a lot of the positive feedback that we got from the community. Not only community members, but also folks and stakeholders who work with the community, including mental health providers and folks from the county, that found our cultural sessions or listening sessions helpful as they continue working with the population, and knew that they worked with a significant Hmong or Southeast Asian population. So, for example, in one of our events, we had participants join breakout groups and assess different types of health or mental health issues from a cultural perspective, after Dr. Xiong, who you heard from earlier, kind of gave a briefer on how spirituality and different cultural beliefs could shape different viewpoints in terms of dealing with health and mental health. And I think this really helps providers better understand like culturally relevant viewpoints and thus, have more capacity to provide appropriate care and treatment options that are not solely based on Westernized standards and actually based off of what stakeholders are sharing that works, and also traditional approaches that have also shown to work and are effective as well to support the community. And we had attendees reach out to us after the events as well with interest in continuing to partner with the organizations to learn more and to continue these culturally appropriate practices. So we saw that as a huge win. And then I think for the next few years, as we continue this work, we really want to focus on building relationships with county stakeholders and continue working to increase community participation in these spaces. I think what we saw was just an incredible amount of interest, but just folks didn't know where to start. And we know people want to be involved, including both elderly and youth and everyone else amongst the spectrum, but they just really needed the support and the how-to get started. So we'll be working with folks and following up with participants as well in the community to think of ways to increase participation and empower them to share their thoughts and their voices in advocating for their local mental health.
Thank you, Mandy. I'm just really excited about the future too, and also mindful of my own internalized, standards around time and expectations. And Carolina needs to go slow. That's really my lesson here. So I'll pass it to Valentine in Montana to share about one achievement you're proud of from this last year and one goal you have for the future.
Sure, thanks. So similarly to Rosa, we experienced, we were able to see, kind of more firsthand the relationship that, Bakersfield has with the county, particularly when we had, county representatives attending, our events and attending the listening session to really hear about, community need. And so we were very happy that we were able to overcome, kind of COVID-19 and personal access barriers in order to host those events so that there was actual real face time with, the people who, are nominally going to be representing, the health interests of the community that Bakersfield American Indian Health Project is representing. And so we were glad we were able to do that because we were able to, witness, the openness and the reception that BHRS staff had in response to the stories told and the lived experiences expressed, during those listening sessions and during that event. And so being able to establish kind of that open contact with the county at the community level was really significant because we, were very aware of the absence of, community voices and participation in, county processes that are, kind of driving the material changes that, fund mental health services in the department for the county. And so that said, our goals related. So ideally, we are looking to increase the amount of engagement in county processes, particularly the community planning process and MHSA funding allocations and planning by having American Indian, Alaska Native, champions, community representatives and voices present at, the different committees, town halls, president focus groups and events in order to, kind of create that continuity of education and consistency of accountability that would allow us to follow, a really effective approach for continual local advocacy for mental health needs and, broadly, and ideally broadly the health needs of American Indians in Kern County. And so, because we really do need, because the county does have a nice robust process for data collection that's really informing their MHSA funding plans. But when reviewing kind of the reports that are that exist at the county level, we see that there isn't robust Native American participation. So their needs aren't being reflected in how programs are being prioritized by the county. And so so the holistic and traditional, practices and, services and treatment modalities that our community, desires and knows are effective for them, aren't going to show up. The pathways for those to be available are not going to be made available unless there's increased, engagement. And we believe that, there is, that staff are receptive, that the pathway forward is there, but it will take, more effort on the part of the county to increase the accessibility of those spaces where there's going to be where those meaningful decisions are going to be made or informed, so that we can actually have our local community's needs represented.
Thank you, Montana. Valentine, would you like to add anything?
I think again, Montana really said it beautifully, but this sort of phrase comes to mind, and we say it sort of in a joking way, but if you think about it, it's like if you're not at the table, you're what's for dinner. And we say that kind of jokingly, but in some ways it's true. We have to really get to those tables, and I think that through this process, we really opened up a lot of doors, and a lot of tables were there with a lot of enthusiastic people and allies to really, I think, work together on achieving some of these outcomes for the American Indian community in Kern County. And so, I think this continued engagement is really just going to, it's going to take a sustained effort, but I think we've already seen a lot of positive, change and doors opening from that process. So there's more work to do, but it's exciting and it's encouraging what we've seen so far.
Thank you. Thank you so much, Montana and Valentine. And Belinda, share with us, what is an achievement that you're proud of from this last year, and what is one goal you have for the future?
Yes, thank you. I apologize if my internet is a little shaky today, but one accomplishment that we at CPEHN we're really proud of, working with our partner RJoy, is that for one, we did establish this new partnership and working together, and so we know that moving forward, it's only going to get stronger as we continue to collaborate more in this area. Additionally, both RJoy and CPEHN are led by two by Black women organizations, and so we're also kind of just wanting to put that base out there as a part of California, and showing that we have this diverse kind of advocacy network that we're trying to create. And so having two Black women-led organizations come together and just kind of really represent for individuals that are in the community that don't feel that they have a voice that's being heard, or if they don't have anyone that looks like them that they can recognize with or identify with. That's just one kind of piece of the movement that we are really proud to represent. Another piece that we are really proud of was being able to hold and pull off the listening sessions with the community as well. Again, they were all done virtually, and they were really impactful. We were able to hear from a lot of the different communities, formerly in prison population. We heard from some of the elderly community, and also some from the Medi-Cal population, but just also folks that wanted to have their experiences heard, folks that wanted to share what experiences were like from them. One of the ways that we do want to move forward is that although we did have a really good turnout, really good attendance for these listening sessions and the convening event, is that we had a less number of attendees that had registered. And a lot of it comes from around the stigma when talking about mental health in the Black community. Even though we were coming together because we want to listen to their voices, we want to know what services are needed and what resources we can provide in the Black community as far as mental health goes. There are still individuals that do not feel comfortable with sharing or talking about their mental health. that they feel that they'll be stigmatized for reaching out, especially with Black men that have a kind of that stigma around reaching out even to each other, or a stigma of seeing a therapist or a mental health professional. And so we want to be able to kind of further that conversation of being advocates and letting folks know that, yes, we identify that there is that stigma, but what's the next step? What can we do to continue these conversations, making sure that your needs are met, and that we can reduce that stigma around mental health. We want to also address the external and internalized racism that is still involved in the system. We know that there is that disproportionality of individuals that are not able to receive mental health services. And even though there are individuals that express a need to have a need to receive services, there still are a larger subset of individuals that aren't receiving it. And so we want to kind of involve ourselves with being that advocate for changing policies at the policy and advocacy level, but we also want to reach the community where they're at. So the organization, Our Joy, is providing that safe, welcoming space where people can come, not have to have any external factors when they come into those spaces. They're coming in knowing that they're fully themselves and that they're being received as fully themselves, and so that they feel comfortable with sharing about their mental health and mental wellness needs. Because a lot of us, it's not only around mental health and mental illness, but it's also about mental wellness. And we want to make sure that folks feel comfortable with being able to express that and to bring in their support systems as well, and not just make healing a closed off experience, but we want to be able to provide that healing in a welcoming space. And so having healing circles is a great way to share in community and that safe space until they feel comfortable with going outside of the community and seeking services. We saw that there were disparities in receiving mental health services in the Black community, and irregardless of insurance status, unfortunately. So no matter between individuals that were receiving Medi-Cal or folks that had private insurance, there was still that stigma. And so we want to make sure that no matter the circumstances, individuals can have access to the services that they need. And so part of that collaboration is that we are trying to put together a toolkit of resources that folks can receive so that they can know where to access mental health services in their local community. So hopefully that will start in Alameda County, but also what we can do to help collaborate on that on, like I said, a larger scale, kind of expanding out to other areas as needed. And we also want to make sure that we're incorporating the voices of the older generation as well, because we know that the older generation has its own specific needs. And so we want to make sure that their voices aren't lost and that they're continuing to be heard as well.
Thank you, Belinda. Thank you so much for being the last person to really share about sort of what we need to consider moving forward as well. Really want to thank all of our panelists so much for sharing a snapshot of their partnership and their work as TA providers, as well as what they would like to do moving forward in their partnership. We are now going to transition to a raffle, a DJ, and lunch. And then after all of that potpourri of enjoyment, we're going to come back and we're going to hear from some of our legislators this afternoon, as well as our last local partner. And we'll also do breakouts to choose your own adventure, as you heard about earlier today when Kieran went over the agenda. Feel free to check out the rest of the day on our program agenda as well. I would like to introduce James now. He's going to do the raffle. And as part of our event, CPEHN is raffling off 2 $300 Visa gift cards. And just by registering for the event, you have been entered into the raffle. So shout out to the audience, you're in there. So I'm excited to introduce James, CPEHN's executive assistant, who will be announcing our first raffle winner.
Thank you, Carolina. And thank you to everybody who participated in our raffle today. We cannot wait to announce who our winners are and hope you've enjoyed our programming thus far. So without further ado, I have the pleasure of announcing our winner for our Right to Heal raffle. And our winner is Dahidi Dola. Again, our winner is Dahidi Dola. And congratulations to our winner. We'll be doing another name drawing closer to the end of our programming.